Imagine sitting in a quiet room, no television, no traffic, nothing, and hearing a high-pitched ringing, buzzing, or hissing sound coming from inside your own ear. You shake your head. You press your palm against your ear. But the sound does not stop. And the moment you try to fall asleep, it gets louder. If you have experienced this, you already know how exhausting and isolating tinnitus can be. People around you cannot hear it. Doctors often tell you there is no cure. And the ringing continues night after night, stealing your sleep and your concentration. Here is what most people do not realize. Tinnitus affects more than 1 in 10 adults worldwide. Among people over 65, studies show that between 30 and 40% experience some degree of tinnitus or associated hearing decline. And when left unaddressed, it rarely stays the same. It tends to worsen and, in some cases, progresses to measurable hearing loss. But here is what almost no one tells you. There are specific pressure points located around the ear that have been used in traditional medicine for thousands of years to address tinnitus, ear congestion, and hearing decline. And modern clinical research is now confirming that stimulating these points can meaningfully reduce tinnitus, loudness, and improve hearing thresholds. Today I am going to show you exactly which points to press, how to press them, and what else to do at home to give your ears the best possible chance of recovery. Stay with me to the end, because I will also share an ancient self-care technique called the heavenly drum method that takes less than 2 minutes and has helped many tinnitus sufferers feel immediate, noticeable relief. First, let us understand why tinnitus happens. The sound is real to you, but it is generated internally, not by an external source. There are 3 primary causes. The first is damage to hair cells inside the cochlea. Deep inside your inner ear, thousands of microscopic hair cells convert sound vibrations into electrical signals that travel to the brain. When these hair cells are damaged by prolonged noise exposure, aging, medication side effects, or infection, they begin sending erratic, spontaneous electrical signals even in silence. The brain interprets those signals as sound. That is tinnitus. The second cause is reduced blood circulation around the ear. The inner ear is one of the most blood flow dependent structures in the entire body. When circulation to the ear is compromised due to muscle tension in the neck, chronic stress, or blood pressure changes, the cochlea and auditory nerve are deprived of oxygen and nutrients. This weakens their function and either triggers or amplifies tinnitus. The third cause is autonomic nervous system imbalance. When you are chronically stressed or sleep deprived, the sympathetic nervous system stays in overdrive. This causes blood vessels around the ear to constrict and disrupts the pressure regulating function of the inner ear. This is why tinnitus is always louder on stressful days and somewhat quieter after genuine rest. Understanding these 3 causes also explains exactly why acupressure around the ear works. Stimulating these specific points improves local blood flow, releases muscle tension, and calms the nervous system. When all 3 effects occur together, the inner ear environment improves and tinnitus quiets. Clinical research on auricular acupressure in patients with noise-induced tinnitus found that the treated group experienced significant reductions in tinnitus loudness compared to untreated controls, along with measurable improvements in hearing thresholds. Multiple studies examining acupuncture for tinnitus consistently identify the same cluster of points around the ear as the most effective treatment locations. These are the 4 points I am going to teach you today. Before you begin, prepare your hands. Rub your palms together vigorously for 10 to 15 seconds until they feel warm. Using warm fingertips improves local circulation during acupressure and prevents the reflex constriction that can occur when cold pressure is applied to sensitive areas. The first point is Erman, also called triple warmer 21. This point is located just in front of the ear, slightly above the small cartilage flap, called the tragus, the little bump that partially covers the ear canal. Open your mouth slightly, and you will feel a small depression form in this area. That depression is Erman. Using your index finger, find this notch and apply firm, but gentle circular pressure. Press for 5 to 10 seconds. Release briefly, and repeat this cycle for 3 minutes. Erman is one of the most commonly used points in traditional medicine for tinnitus, ear fullness, and age-related hearing decline. The second point is tingong, or small intestine 19. This point sits directly in front of the ear canal opening, just below ermine. When you open your mouth, a small hollow forms here as the jaw moves forward. Place your fingertip in that hollow, and apply the same circular, rhythmic pressure as before. 5 to 10 seconds on, a brief rest, repeated for 3 minutes. Tingong translates roughly as palace of hearing, and it is historically regarded as the central governing point for all ear conditions, including tinnitus, hearing loss, and inner ear congestion. The third point is tingui, or gallbladder 2. This sits just below tingong, at the bottom of the natural ear. Indentation in front of the earlobe. You will notice that ermine, tingong, and tingui form a vertical row of 3 points along the front edge of the ear. Once you have located all 3, you can press all of them simultaneously using your index, middle, and ring fingers placed side by side. This 3-finger approach stimulates the entire anterior ear region at once, and is considered more powerful than pressing each point individually. Apply gentle but steady pressure with all 3 fingers for 30 seconds. Release, and repeat 5 to 6 times. The fourth point is yifeng, also called triple warmer 17. Unlike the first 3, this point is located behind the ear. You will find it in the small, soft depression between the earlobe and the prominent bony ridge behind the ear called the mastoid process. Slide your fingertip behind the earlobe and press gently inward. You should feel a noticeable hollow. When you press correctly, you may feel a slight soreness or release of tension. This point is especially effective for tinnitus, triggered or worsened by neck tension, jaw problems, or stress. Press inward and upward slightly. Hold 5 to 10 seconds and repeat for 3 minutes. Now I want to teach you the heavenly drum technique. This method comes from traditional Chinese qigong, used for centuries to protect hearing and reduce tinnitus. It looks a little unusual, but the physiological logic behind it is sound. It creates vibration that stimulates the cochlea, promotes circulation in the inner ear, and activates the auditory nerve without any external tool or cost. Here is how to do it. Cup both palms firmly over your ears, creating a seal so that no air passes in or out. Your fingers naturally rest on the back of your skull. Now place both index fingers on top of your middle fingers. Then snap your index fingers down sharply, so they flick against the base of your skull. You will hear a deep, resonant drumming sound inside your sealed ears. This is the vibration traveling through your skull and into the cochlear fluid. Perform this flicking motion 24 times. Do this once daily, immediately after your acupressure routine, for a combined session of about 12 to 15 minutes. Beyond acupressure, certain daily habits either protect or damage your auditory system significantly. Changing these is just as important as the manual techniques. Earphone volume and duration is the most critical factor. The World Health Organization identifies excessive personal audio device use as one of the leading preventable causes of hearing loss globally. If you already have tinnitus, loud earphone use is likely, making it worse every single day. Follow the 60 to 60 rule. Keep volume below 60% of maximum and limit continuous use to 60 minutes at a time. Caffeine and sodium both affect inner ear fluid pressure. High caffeine intake constricts blood vessels and overstimulates the nervous system, which worsens tinnitus in many people. High sodium intake raises inner ear lymphatic pressure. This is particularly relevant for people with Meniere's disease-associated tinnitus. Reducing both often leads to a noticeable decrease in ear fullness and ringing intensity. Neck and shoulder tension directly impairs blood flow to the ear. Prolonged forward head posture looking down at a phone, sitting at a desk for hours, chronically tightens the muscles that supply the auditory region. 3 to 5 minutes of gentle neck rotation and tilt stretching, 2 or 3 times daily, can make a meaningful difference in how your ears feel by evening. Before closing, several important cautions. The techniques in this video are supportive, self-care practices. They are not a substitute for medical evaluation. Please see an ENT physician promptly. If you experience sudden hearing loss in one ear, tinnitus, accompanied by dizziness or vertigo, ear discharge or pain, alongside tinnitus, or a pulsing tinnitus, that beats in rhythm with your heartbeat. These symptoms may indicate sudden sensorineural hearing loss, Meniere's disease, or vascular abnormalities that require immediate professional assessment. When pressing acupressure points, use firm but never painful pressure. Mild soreness or a sensation of release is appropriate. Sharp pain is a signal to reduce pressure. If this video helped you, please subscribe and share it with someone who struggles with ringing in their ears. You might be giving them the best night's sleep they have had in years. Thank you for watching.